Another topic that we will discuss are thermal injuries, okay? By chapter 14. Thermal injuries. It is caused by an appreciable deviation from normal temperature, capable of producing cellular or tissue changes in the body. Exposure to high temperature may cause burning or scalding. Okay? So, it is the reaction of the skin to heat. Okay? To calor. Exposure to severe cold may cause frostbite. Thermal death is one primarily caused by thermal injury. Okay? So, thermal injuries is not only limited to heat but also to cold. Okay? Too much cold can damage the um, too much cold can damage the nerves. Okay? It can kill the nerves. That's why in places like Antarctica, okay, which are very cold, they use very thick jackets, okay, in order to protect themselves from frostbite. So this illustration is a classic example of thermal injury, okay? Death or injury from cold. Death or injury due to cold is not common in tropical countries. Most of the primary death cases is attributed to decreased dissociation of oxygen from hemoglobin in the red blood cell and diminished the power of the tissue to utilize oxygen. Cold produced a vascular spasm which results to anemia of the skin surface. Prolonged exposure can cause necrosis and gangrene. The severity of the cold, duration of exposure, area of the body involved, sex, and humidity decided the degree of damage. So, in this illustration, the person died due to too much cold. Okay? Death from cold. This is a picture of a tropical region, like in the Philippines. Okay? We are a tropical country. Effects of cold. Local effects like frostbite, immersion foot, trench foot. First stage, blanching and paleness of the skin due to vascular spasm. Second stage, erythema, edema, and swelling. Third stage, vascular paralysis, blister formation. Okay? So, maybe at the third stage, nerves are already damaged. Fourth stage, continued exposure to severe cold will later lead to necrosis, vascular occlusion, thrombosis, and gangrene. So there is already cellular death. Okay? Systemic effects. It is reflex in nature brought about by the stimulation and paralysis of the nerves. Respiration, heart action, metabolic process getting slowed down on account of anoxia. So in this picture, this is an illustration of a frostbite. Okay? There is already damage in the nerves and cellular necrosis. Okay? Trench foot. Okay, that's the illustration of trench foot. Immersion foot. Okay? It is already damaged also due to too much cold. Signs and symptoms. Gradual lowering of the body temperature is accompanied by increasing cold stiffening, weariness, and drowsiness. Lethargic, passing the stage of coma to death. Delusion, convulsion, and delirium. Palpitation of the cutaneous surface shows hardening and coldness. Post-mortem findings. Externally, characteristic, cold stiffening, pale skin, reddish patches, especially in exposed portion, and onset of rigor mortis is delayed. Internally, blood is generally fluid in heart and blood vessels. Audible cracking sound on flexing the knee and other joints. Petechial hemorrhage in the lungs, brain, and kidneys. Death or injury from heat. The effects of heat in the body may be local at the application or general when the whole body is affected. Classifications: general or systemic effects, heat cramps or heat exhaustion or heat stroke. Local effects, scald and burns. Heat cramps. It is the involuntary spasmodic painful contraction of the muscles. Heat exhaustion. This is due to a heart failure, primarily caused by heat and precipitated by muscular exertion and warm clothing. Okay? Heat stroke, very common. This occurs to people, those who are working in high temperatures. Okay, here's an example of a heat cramp and exhaustion. Okay, due to heat, the muscle becomes tense and spasmodic. Okay, now let's go to post-mortem findings. Okay, the findings after death, the examination of the body after death. Cadaveric rigidity comes soon and passes off soon. Putrefaction occurs early. Okay? Lividity is marked. Petechial hemorrhage may be found in the brain and heart. Congestion of the internal organs. The temperature may rise after death. Okay? But this is not due to circulation, but this is due to putrefaction. Okay, the inside of the body is starting to decompose or deteriorate. Okay, burns caused by dry heat occurs at or above the site of contact of the flame. Singeing of hair is present. Clothings are burned. Injury may be severe. Okay? In the other hand, scalds caused by application of moist heat occurs at or below the site of contact with liquid. Singeing of hair is absent. Clothings are not burned. Usually limited on account of the dissipation of heat in the tissue. Okay? So with scalds, this involves hot liquids. Okay? While in burns, this includes heat, hot surface, or fire. Okay? So that's the illustration of a burn. And at the right side, that's the illustration of a scald. Okay? So that you can better appreciate those conditions. Different classification of burns. There are thermal burns, chemical burns, okay, electrical burns, radiation burns, and friction burns. So, here's an example of thermal burn, okay, at the left side. And at the right side, chemical burn, okay, by the use of acid and so on and so forth. Okay, at the left side, electrical burn, okay, when a patient is electrocuted. And then at the right side, radiation burns, okay, like sunburn and other um, equipment that has radiation. Friction burn, okay, by due to hard surfaces, okay, when your skin is pressed on hard object, and then when you move, it produces friction. So the result would be friction burn. Classification of burns by degree. There is first degree. There is erythema or simple redness of the skin associated with superficial inflammation and slight swelling. It is also produced by mild irritant. And then second degree burn. There is a vesicle formation with acute inflammation. The skin is blackened. And then third degree burn. There is destruction of the cuticle and part of the true skin. It is very painful. Healings may leave a scar. And then there is fourth degree burn. The whole skin is destroyed with formation of slough, which is yellowish brown or parchment, like the surface is ulcerated. Okay? And then fifth degree burn. There is involvement of the deep fascia and muscle. Okay? This may result to severe scarring effect and deformity. And then the sixth degree burn. There is charring of the limb involving subjacent tissue, organs, and bones. Okay? Those, it's very deep that you can see the bones already and the organs. So, here are types of burns, okay? So that you can better appreciate. So, above this illustration is the first degree burn, okay? What is affected is the epidermis, the dermis, and the subcutaneous level of the skin. Okay? The second degree burn is much deeper. And then the third degree burn, you can see the muscles already. Factors influencing the effect of burns. So here are the factors that may influence the extent of damage. The degree of heat applied, duration of exposure or contact, extent of the surface involved, portion of the body involved, age of the victim. Of course, because as you age, your skin becomes dry, okay? And if the integrity of skin is poor, then you are susceptible to extensive damage. And then sex of the victim, septic infection, and then the depth of burns. Now, let's go to physical injuries or death by lightning and electricity. So, death or physical injuries by lightning. What is lightning? It is a naturally occurring electrostatic discharge during which two electrically charged regions in the atmosphere temporarily equalized themselves, causing the release of electrical potential of 1,000 million volts and about 2,000 amperes. Also, energy is liberated which is converted into heat. Because of this amount of power, it can cause injury to human body. Okay? So as you can see at the right side, the picture shows injury due to lightning. Okay? Elements of lightning that produced injury. First, there is direct effect from the electrical charge. Electrical charges produce electrocution in the body, since the nerves of the body are good conductors of electricity. And the next, surface flash burns from the discharge. Superheated air burns the skin. Arborescent markings are found in flash burns. And then mechanical effect. This will cause laceration, severe tearing of the clothing, and displacement of body parts. And then the compression effect. The compressed air produces backward wave, causing sledgehammer blow on the body of the victim that results in concussion, shock, or unconsciousness. Okay, so if you are the physician, take note of the extent of the damage so that you can arrive to a proper diagnosis. Okay, so you should consider the following: the location history, evidences of lightning effects, metallic articles are fused and magnetized, fused glass materials, absence of suicidal or homicidal wounds, arborescent markings in skin, burns present in the part under the pieces of metals such as watch, knife, or bunch of keys. Okay, so these are the determining factors because if a person is struck by lightning, okay, then these things might happen. Okay, because what if within the course of your investigation you found out that the cause of death is not due to lightning but due to homicide. Okay, that person was really electrocuted or killed by another. Okay, so the case is murder. Okay, here's the diagram, classification of burns. So surface burns seen under metallic objects worn or carried by victim. Okay, so if the victim wears a watch, okay, so a surface burn can be seen in that area. And then linear burns seen in moist creases and folds of the skin, okay, like the armpit. And then arborescent or filigree burns, radiating burns similar to electrocution. Lightning and its effect. So a survey was conducted worldwide and they found out that lightning causes serious injuries in 1,000 to 1,500 individuals every year. Okay? Only 20% of those struck by lightning die immediately. Persons struck are typically males aged 15 to 44 years old. Most injuries occur between May and September, the rainy season. The current in a lightning bolt is as high as 30,000 amperes with 1 million or more volts. The short duration of about 1 to 100 milliseconds limits but doesn't prevent injury. Lightning-caused injuries fall into four main categories, which depend on the actual path the electrical current of the lightning stroke takes as it flows through or over the victim on its way to the ground. Okay? So there is direct strike, splash, ground current, and blunt trauma. This large flow of electrical current damages the human body through the sudden release of electrical, thermal, and mechanical energy. And the injury suffered from a particular lightning strike may involve tissue damage from one or all of these mechanisms. Manifestation, okay? Take note of the manifestation if you are the physician. Cardiopulmonary complications, transient hypertension, electrocardiographic changes, okay? Changes in the heart rate, myocardial injury or infarction, okay? Death of the heart muscles, congestive heart failure, dysrhythmia, transient asystole, atrial fibrillation, ventricular fibrillation, okay? Mostly the heart is affected. Frequent premature ventricular contractions, apnea, hypoxemia. Now, death or physical injuries from electricity. So the main cause of death in electricity is shock. 100 to 250 volt and the effect of 300 volt and above may similar to lightning stroke. Electric shock occurs upon a contact of a human body with any source of electricity that causes a sufficient current through the skin, muscles, or hair. Electricity flows through conductors. Conductors include metal, water, the earth, and the human body, and it must have a complete circuit or path to flow. An increase in the conductivity of the body will promote more injury. Electrical shock always needs emergency medical attention, even if the person seems to be fine afterwards. Okay? As you can see in the illustration, it is common for children to get shocked because they play, okay, within the apparatus or devices that you connect to electricity. So always watch your children. Factors which influence the effect of electrical shock: intensity of the current, frequency of the current, current path through the body, length of time current passes through the body, high moisture in the room and on your body, of course, because water and moisture is a good conductor. General health of the person prior to the shock, the phase of the heart cycle when the shock occurs. Remember, it is the amount of current flow through the body, not the amount of voltage contacted, that determines the severity of a shock. Okay? Because it is the current that will cause damage. For example, if the person is moist, okay? So the person will be electrocuted more because of the state of his skin. Wet conditions are common during low voltage electrocution. Under dry conditions, human skin is very resistant. Okay? Wet skin dramatically drops the body's resistance because of its conductivity. Because water is a good conduction of electricity. Mechanism of death in electrical shock: ventricular fibrillation, which may lead to rupture of some of the muscle fibers, and focal hemorrhage in low voltage. Next is respiratory failure due to bulbar paralysis in high voltage. Next, mechanical asphyxia due to violent and prolonged convulsion. And then, can result in secondary injuries like fall from height or muscle tears. Death by lightning and electricity. Electric necrosis is cell death caused due to progressive obstruction due to passage of electricity while electrocuted. Repair or healing process leaves a smooth, thin pink scar. Due to electric burns, there is damage to skin and deep layers where it has compression of corneum and superficial carbonization. Symptoms of electric burn if death not occurred: cold body surface, strenuous breath, irregular rapid pulse, and pale face. Metallization. The metal of the conductor is volatile and particles of the metal are driven into the epidermis. Okay? If it is iron, the color is yellow-brown. If it is copper, there will be a blue mark at the burns. Delayed effects of electrical injuries. Necrosis of the area involved later developed gangrene because of the arterial damage, and these arterial damages become brittle and friable, which causes hemorrhage. The late nervous injuries may be manifest in the form of retrograde amnesia, hemiplegia, post-concussional syndrome. Post-mortem finding. First, the electrical arborization or the formation of a tree-like arrangement, okay, due to the pathway of the electricity. And then, burns with metallization, intense vascular congestion of the dura mater, eyes congested and pupils dilated, lungs deeply engorged and edematous, congestion of visceral organs. Now, how you treat the person who is electrocuted or was hit by lightning? Okay? Victims should be moved from the live installations. We have to provide artificial respiration for an hour. After spontaneous respiration, victim's temperature should be raised and cerebral edema treated by lumbar puncture. Stimulation may be given to improve the health. Now, the medical legal aspect. Electrocution death is accidental, rarely suicidal or homicidal. Let's go now to death or physical injuries due to change of atmospheric pressure. Barotrauma. Death or physical injuries due to change of atmospheric pressure or barotrauma. So, the normal atmospheric pressure at sea level is 760 millimeters per mercury. That's the standard measure of pressure. Below the sea level, increased atmospheric pressure. And above the sea level, decreased atmospheric pressure. Hyperbarism, increase of atmospheric pressure, usually observed in scuba divers, pearl divers, salvage divers, treasure hunters, or pleasure swimmers, and etc. Okay? If they go too much at the deep sea. Henry's law. At constant temperature, the amount of gas dissolved in a liquid is directly proportional to the pressure. At 10 meters depth, atmospheric pressure is doubled. By Henry's law, there will be an increased amount of gases dissolved in the blood and body fluids. So there is an effect inside the body. At 6 meters depth, diver needs twice the volume of gas than on surface. At 33 meters, divers needs fourfolds of volume than on the surface. The longer the diver remains under pressure and the deeper he descends, the greater is the degree of gas saturation of tissues and greater the length of time required for subsequent decompression. Nitrogen narcosis. Nitrogen constitutes approximately 80% of the air in the lungs. Nitrogen is also absorbed by the tissues, causing drunkenness of the deep or nitrogen narcosis. It is followed by euphoria. Okay? That's the effect if you are in the deep sea for too long. It will cause nitrogen narcosis, and then it would lead to euphoria. Okay? It has mental effect. Causes of hyperbarism: pulmonary edema, pulmonary blood vessel rupture or hemorrhage, eardrum bulge inward, perforation of the tympanic membrane. Effects of deep diving: cerebral anoxia due to a prolonged stay underwater, muscular cramp, physical injuries in the process of diving and hitting hard objects, injuries caused by aquatic animals like shark or stings of venomous fish, and coelenterates. Effects of the changes of atmospheric pressure in a pre-existing disease like hypertension or a coronary affection. Ascending from a high atmospheric pressure of the deep sea to the surface atmosphere. Ascending gradually. None of the below effects will not be observed. Ascending rapidly. Sudden release of gas bubbles from body fluids accumulating in the circulation, causing emboli. Okay? So, if your ascent is rapid, it can cause emboli in the bloodstream. Interstitial emphysema on the chest wall, face, and neck. Pneumothorax, pulmonary emboli. Bends or air emboli in the large joints causing semiflexion. Air embolism causes ischemia, pruritus, pain, and if present in vital organs, it leads to death. So here is an illustration of the after effects of barotrauma. Okay? If the person is in the deep sea level for a long period of time. Okay? It can cause cerebral air embolism, and then subcutaneous emphysema, and pneumomediastinium, okay, in the lungs. And it can rupture the alveoli. Air enters the pulmonary capillary, and then pneumothorax in the lungs. The alveoli will expand. Okay? So just study the illustration. Hyperbarism, post-mortem findings. Okay? If immediate death, subcutaneous emphysema, generalized visceral congestion, extravascular bubbles, and hemorrhages in adipose tissues. Okay? Please refer to your book, guys, because our discussions are just matters of reading. Okay? They are self-explanatory. Next is death after several days. Degeneration and softening of the white matter of the spinal cord, fat necrosis of the liver, and osteonecrosis. Decompression. Hypobarism: at a higher altitude, the atmospheric pressure becomes lower and more gas will be liberated by the body fluid. The release of gases from the body fluid will cause bends or the joint and muscular pain due to the presence of air bubbles. Chokes, substernal distress, a non-productive coughing and respiratory distress. Substernal emphysema or accumulation of bubbles underneath the skin. Trapped gas may result in the doubling of the size of hollow viscous like the stomach and intestine at 18,000 feet level, the size of quadruples at 33,000 feet. So here's an illustration of decompression. Okay, at the left side is a healthy lung, and then at the right side is a condition called emphysema. Okay, anoxia. At higher altitude, the oxygen content of the atmosphere becomes lesser and lesser. And then hypoxia, felt between 8,000 feet to 15,000 feet. Aircraft injuries and fatalities. So, during the flight, altitude causes decompression. Speed. A sudden change in the speed of 500 miles tends the blood in the brain to move to the lower extremities, causing momentary blackout or unconsciousness. And then, formation of toxins like carbon dioxide, carbon monoxide, poisoning. Temperature falls 40 degrees below zero at the level of 25,000 feet. And then, pre-existing disease, coronary disease, or hypertension. It aggravates those conditions. Aircraft injuries and fatalities during the crash. Fracture of the tibia and fibula is due to the presence of the horizontal bar at the rear of the front seat. So, during an airplane crash, always follow protocols because the seats can cause damage or fracture to the extremities of the body, okay? Especially the force of the landing, okay? So, always follow protocols in case of impending airplane crash. Fracture of the femur is due to high vertical force and the front bar of the seat. Sternal injuries due to the flexion at high speed. Craniofacial injuries is due to the impact of the head to the seat in front when subjected to a vertical hit. There may be a fracture of the classical ring type surrounding the foramen magnum due to the vertical force. Rupture of the heart or aorta due to compression by the sternum and spine. Heart is torn from the static aorta during deceleration of the body in the vertical fall of the body. Now, let's move on to death or physical injuries due to athletic sport. Okay? Training methods. Weight training is a common type of strength training for developing the strength and size of skeletal muscles. Okay? For example, lifting weights to increase the size of your muscle. It utilizes the force of gravity in the form of weighted bars, dumbbells, or weight stacks in order to oppose the force generated by muscles through concentric or eccentric contraction. Weight training uses a variety of specialized equipment to target specific groups and types of movement. Okay? As you can see in the picture, the people are using different types of weight equipment, okay, in order to increase their muscle size. And of course, during training, you are prone to injury, okay? And we will discuss that along the way. Injury, also known as physical trauma, is damage to the body caused by external force. This may be caused by accidents, falls, hits, weapons, and other causes. Major trauma is injury that has the potential to cause prolonged disability or death. Okay? So, be careful when training because too much injury can cause death. Nutrition. Nutrition is the science that interprets the nutrients and other substances in food in relation to maintenance, growth, reproduction, health, and disease of an organism. It includes the food intake, absorption, assimilation, biosynthesis, catabolism, and excretion. Okay? So, if you are training, you will also eat healthy foods, okay? In order to help you gain muscles and be healthy. The diet of an organism is what it eats, which is largely determined by the availability and palatability of foods. For humans, a healthy diet includes preparation of food and storage methods that preserve nutrients from oxidation, heat, or leaching, and that reduce risk of foodborne illnesses. The 7 major classes of human human nutrients are carbohydrates, fats, fiber, minerals, proteins, vitamins, and water. Nutrients can be grouped as either macronutrients or micronutrients. Okay? Food will help you in training, especially foods that is high in protein. Okay? For weightlifters, they eat foods high in protein in order to help them grow their muscle. Okay? However, if you are a marathon runner, you need food high in carbohydrates and water, okay, to help you in your activity. Boxing, okay? In the Philippines, boxing is one of the most famous sport. It is a combat sport in which two people, usually wearing protective gloves, throw punches at each other for a predetermined amount of time in a boxing ring. Amateur boxing is both an Olympic and Commonwealth Games sport and is standard fixture in most international games. It also has its own world championship. Okay? So of course, boxing is a physical sport, and as you can see in the pictures, it can cause damage to the extremities of the body and the face and other areas that is hit by the punches. Okay? A winner can be resolved before a completion of the rounds when a referee deems an opponent incapable of continuing. Disqualification of an opponent or resignation of an opponent. When the fight reaches the end of its final round with both opponents still standing, the judges' scorecards determine the victor. In the event that both fighters gain equal scores from the judges, professional bouts are considered a draw. In Olympic boxing, because a winner must be declared, judges award the contest to one fighter on technical criteria. Okay? Potential injuries in boxing. So most common site is facial injuries. Spectacle hematoma. It is a serous effusion on the loose tissue around the eyeball and in the eyelids. Puffiness and closure of eyes. Okay, like black eyes. Cauliflower ear. Scarring and fibrosis brought about by hemorrhagic trauma and necrosis of auricle cartilage of the ear pinna. Okay? Have you seen UFC? The players has cauliflower ear. Okay? Due to their heavy training. Retinal detachment, fracture of nasal septum, mandible and maxilla, renal damage, intracranial injuries, most serious sequelae. Intracranial injuries, cerebral concussion or transient lateral occipital complex. Okay? Subdural hemorrhage, most common injury which may be localized or extensive due to tear in dural emissary vein. Fontaine hemorrhage or boxer's hemorrhage due to severe head blow causing acute flexion and extension of the head, resulting in brain stem to be pinched over the tentorium with hemorrhage. Okay? As you can see in the diagrams, there are internal bleeding inside the head due to trauma. Okay? Due to head injuries. Effects on the brain of a boxing blow depends on the location, direction, intensity, velocity, and number of blows. Okay? So, first, rotation acceleration or angular acceleration. A blow which causes the rotation of the movable head will cause the inert brain to lag behind the accelerated skull, who has lost control of his neck muscle in the head, which is most susceptible of sudden acceleration. Okay? as shown here in the diagram. The effect, subdural hematoma. The bridging veins that connects the brain with the superior sagittal sinus of the dura mater is tight bound to the skull. Intracerebral hemorrhage. The rotation movement of the brain within the accelerated skull may tear vessels in the brain. Such hemorrhage may develop in the parasagittal region of the cortex and subcortical white matter. And then, diffuse axonal injury. Damage to the axon of the white matter is common to head trauma. A few severed axon may not be sufficient to produce clinical symptoms. However, if there is increase with damage, eventually clinical deficits becomes apparent. Linear or translation acceleration. A straight blow on the face may cause focal ischemic lesions, notably in the cerebellum, a few days after bleeding. In Golgi boxers, sudden linear acceleration also may produce hyperextension of the neck, which is known to damage axons of the medullary pontine angle and the reticular substance, resulting to a knockout. Okay? Just study this diagram. Injury to the carotid. Blows to the neck can damage the carotid. Dissecting aneurysm or occlusion by the thrombus may follow. Pressure on the carotid sinus induces reflex mechanism that causes hypotension and bradycardia, associated with decreased blood flow to the brain. A loss of muscle tone and brief fainting spell will contribute to a boxer's grogginess and increase his susceptibility to head acceleration by successive blows. Okay? Guys, these are just matters of reading. Please refer to your book. Impact deceleration. After a knockout, the boxer hit the rope or mat, fall on the back, and produces rapid deceleration, which typically results in contusion of the orbital surface of the frontal lobes and the tips of the temporal lobe. The crest of the convolution are apart, which is associated with parenchymal and subarachnoidal hemorrhages. Okay? Just study this diagram. Okay? The first picture shows concussion, a traumatic brain injury that changes the way your brain function. Okay? And the explanation is at the right. Cerebral edema. Severe trauma on the head is usually followed by cerebral edema. It increases pressure on the swollen brain within a confined space of cranial cavity, which affects the blood flow that leads to edema. The increasing of intracranially causes the brain to herniate through the foramen magnum. Death results from ischemia and hemorrhage due to compressed of midbrain after herniation. Okay? So, in this diagram, you can see the cross-section of the head using a CT scan. That is the normal figure. However, at the right side, that's the cerebral edema. Okay? Delayed consequences of brain damage. The delayed sequelae is encephalopathy, which is characteristic by slurred speech, slow, clumsy movement, tremor, progressive dementia, unsteadiness of gait, poor tolerance of alcohol, and symptoms of progressive ventricular dilatation. Now, let's go to wrestling. Okay? Common injuries suffered by combatants. Injury to the cervical spine, fracture and or dislocation, especially when the wrestler forms a bridge during the contest. There is a bridge when the trunk and neck is hyperextended and the body weight is supported by the head, which touches the ground and feet. Knee injury, usually meniscus or ligament tear that follows hyperextension and rotation of the leg. Injuries to the shoulder joint and a rotator cuff result from twisting of the trunk and upper extremities. Facial injuries and matte burns due to contact of the face to the floor. Abdominal hemorrhage due to rupture of organs in violent fall. Okay, now, let's go to another topic, child abuse or neglected child. Child abuse. What is child abuse? It is when a parent or caregiver, whether through action or failing to act, causes injury, death, emotional harm, or risk of serious harm to a child. There are many forms of child maltreatment, including neglect, physical abuse, sexual abuse, exploitation, and emotional abuse. There are different types of child abuse: physical abuse, sexual abuse, emotional abuse. Okay? In the Philippine setting, there are many laws protecting the rights of the child. First is the Child Abuse Act. Okay? Second, the Violence Against Women and Children. Okay? Third, in other special laws and in the revised penal code. Stop child abuse. Okay? Physical abuse. Physical abuse of a child is when a parent or caregiver causes any non-accidental physical injury to a child. There are many signs of physical abuse. So, as a physician, take note of the signs: bruises, blisters, burns, cuts, and scratches, internal injuries, brain damage, broken bones, sprains, dislocated joints, emotional and psychological harm, lifelong injury, or death. Can't or won't explain injury of child or explains it in a way that doesn't make sense. Okay? The number 6 is referring to the perpetrator. Physical abuse, as you can see in the image. And then sexual abuse. Emotional abuse, when a parent or caregiver harms a child's mental and social development or cause severe emotional harm. It is considered emotional abuse, like shaming or humiliating, calling a child names, criticizing, belittling, demeaning, berating, mocking, using language or taking action that takes aim at child's feelings of self-worth. Delays in development, wetting bed and the pants, speech disorder. Okay? Signs of emotional abuse. Okay? Child neglect. Child neglect is when a parent or caregiver does not give the care, supervision, affection, and support needed for a child's health, safety, and well-being. Child neglect includes physical neglect and inadequate supervision, emotional neglect, medical neglect, educational neglect. Okay? Physical neglect. Deserting a child or refusing to take custody of a child who is under your care. Repeatedly leaving a child in another's custody for days or weeks at a time. Failing to provide enough healthy food and drink. Okay? Now, let's go to emotional neglect. What are the signs of emotional neglect? Ignoring a child's needs for attention, affection, and emotional support. Exposing a child to extreme or frequent violence, especially domestic violence. Permitting a child to use drugs, use alcohol, or engage in crime. Keeping a child isolated from friends and loved. So, this is an image of a childhood emotional neglect because the parents are fighting. Medical neglect. Not taking a child to hospital or appropriate medical professional for serious illness or injury. Keeping a child from getting needed treatment. Not providing preventive medical and dental care. Failing to follow medical recommendation. for a child. Okay, these are just educational neglect, allowing a child to miss too much school, not enrolling a child in school, or not providing comparable home-based education, keeping a child from needed special education services. Now, that ends our discussion for that topic that we have discussed. We have other topics to be discussed, and please refer to your book because as you can see, our lectures is more on matters of reading like enumeration, definition of terms, okay? So always refer to your book because our lecture is just a guide, okay? It is just a skeletal of the book. It will only assist you in your reading. So read your book, and then if you have questions, do not hesitate to ask me. I will answer all your questions, okay, to the best of my ability. And also, if you want to clarify some points, you want to have a live lecture or discussion, we can do that, okay? Just message me. Do not be shy. So, thank you and God bless us all.